Hello, and thank you for visiting our virtual booth at the American Telemedicine Association Conference. We are Array Behavioral Care, an organization with 21 years of experience delivering behavioral health care across the continuum. Our services and programs increase timely access to quality behavioral health clinicians from the most restrictive points, such as psychiatric inpatient settings in the emergency department, all the way down to the least restrictive points in the continuum of care, such as delivering care directly to patients in their homes. The focus of this video recording is on Array's OnDemand Telepsychiatry Services, which can commonly be found in acute medical settings, such as hospitals and health systems, emergency departments, inpatient psychiatric units and medical floors, as well as in mobile crisis units, crisis stabilization units, and crisis centers within the community. So what is on-demand care? On-demand care allows for a team of behavioral health clinicians working in a coverage model to respond in an as-needed fashion to needs that arise within a hospital emergency department or inpatient medical floor. The scope of services is vast. Typically, an on-demand care clinician is performing an initial psychiatric assessment, a risk evaluation, and can also be utilized to initiate treatment, such as stabilizing treatment in the ED, or to process admissions to a unit for inpatient placement. You'll also find that on-demand care can be very useful in helping to help process bed placement or case management types of services. Specifically thinking about the problems that on-demand care can solve. In the emergency department, on-demand care is typically deployed to solve a high incidence and long duration of psychiatric boarding. On-demand care can drastically improve the throughput and reduce the length of stay for behavioral health patients within the ED. And you'll also find that on-demand care will typically reduce a facility's reliance, inappropriate reliance, on scarce psychiatric inpatient resources. On-demand care allows emergency departments to quickly determine the most appropriate, least restrictive level of care for behavioral health patients. On the inpatient med-surg floor, on-demand care clinicians work very collaboratively with hospitalists to determine the appropriate diagnosis and treatment of patients on the med floor, and can be instrumental in helping to process in a timely fashion capacity for discharge evaluations. On the inpatient psychiatric unit, on-demand care is frequently used to process admission orders in a timely fashion, and can also be used to provide coverage for crises or needs that arise on the unit without distracting from the routine work of rounding clinicians. We also find that Array's at-home care is a very valuable tool for discharge planners from EDs, from medical floors, and from other levels of care that are looking for options within the community to discharge a patient to. At-home care provides a timely and convenient option for discharge. And finally, when working within a hospital, we'll oftentimes find that we're able to work upstream of the hospital to identify needs in the community to augment access to care. And it's not uncommon that you'll find Array programs deployed within the community around a hospital that we serve to increase timely access and prevent patients from seeking care in the ED unnecessarily. On-demand care is not just service provided from board-certified psychiatrists, although that is the model of care that we started with 21 years ago. We've recently found that augmenting this team with LCSWs allows for essentially an on-demand treatment team to be deployed within an acute setting. Array is proud to be able to offer standalone on-demand care from psychiatrists and psych nurse practitioners, and or on-demand care teams staffed with LCSWs or similar level licensed behavioral health clinicians. We found that on-demand LCSWs can be very valuable in conducting timely initial triage of patients in the ED. What is the best intervention for this patient? To also conduct the initial assessment of the patient, and also to assist after the disposition has been made to help find the most appropriate next step, such as bed placement services. The typical workflow for on-demand care in the ED starts when on-site staff puts in a consult request, either within the Access Array platform or via direct phone call to our employed Access Center staff within our corporate offices. The Access Center staff allocates that consult to the most appropriate clinician who's credentialed and privileged with the facility, and then the Array clinician will contact the hospital to first talk with stakeholders on the ground about what they see, what's going on with the patient, evaluate any documentation that's available within the electronic medical record, and then typically we will conduct a full video evaluation, which may or may not also include collecting additional collateral to ensure that our clinician has the best perspective to make the most appropriate, least restrictive level of care determination for that patient. The Array clinician documents directly within the facility's electronic medical record, can put orders into a CPOE if it's clinically appropriate to initiate stabilizing medication, and then can work with on-site staff to ensure that our recommendations or our orders are fully understood, and before we move to the next patient, we're able to wrap up the case with those patients. The implementation plan for on-demand care services follows a detailed project plan that's informed from 21 years of experience with having implemented on-demand care services in hundreds of settings across the country. There is a dedicated implementation and operations team from Array that will assist in some of the key milestones of implementation, which include credentialing and privileging, development of operational and clinical workflows, as well as training. Training is a critical step in this process to ensure that stakeholders on the ground within the setting are confident and comfortable with the best way to facilitate the encounter, to educate the patient, and ensure that the intervention is effective and efficient. Thank you for taking the time to watch this recorded video at the American Telemedicine Association Conference. We sincerely hope we have the opportunity to talk about partnership with your organization and that you see value in the array of care that we provide across the continuum and allow us to help your organization meet its behavioral health objectives.